Welcome to your favorite health show. Previously, we looked at peptic ulcer. I hope you have learned a thing or two. You don't want to go anywhere. Stay tuned because you'll learn something again today. Welcome back. Thank you for staying with us. On today's episode, we'll continue our discussion on peptic ulcer disease. My name is Dr. J, and I'm your anchor on this show. So, continuing from where we stopped, you remember we said that peptic ulcer is a sore on the lining of the stomach. And then we also tried to look at where the stomach is, which is a part of the intestinal tract between the esophagus and the intestines. We'll continue the discussion today by looking at the treatment and the prevention. So what do you do when you suspect you have peptic ulcer? Go to the nearby pharmacy and then get antacids, which could be syrups or tablets. Now, when you take the syrup, the outcome determines what you do next, because the antacids usually are the first line treatment for peptic ulcer. So if you take the antacid and it relieves the pain, then most likely what you have is peptic ulcer. In which case, the next line of action is to see a doctor. So when you see your doctor, then he will determine the same process of history, examination, and then running a couple of investigations will enable him to determine whether it is still peptic ulcer, because for some degree of peptic ulcer, it may not even respond to antacid. Sometimes again, the pain is not as a result of peptic ulcer. So your best bet is to see your doctor. But what you can do at home, once you have that upper abdominal pain, then you can take the over-the-counter antacids and then see how it goes. If you respond, you will still need to see your doctor. He will decide on the treatment. There's an infection that is associated with peptic ulcer called H. pylori. So there's a treatment for eradication. There's a treatment to minimize the acid that is being secreted. All of these, when combined, will be able to treat and cure the peptic ulcer completely. However, there may be recurrence. Peptic ulcer can recur. That doesn't mean it wasn't treated properly the first time. But what happens is, once it's treated, it leaves something like a scar. So when you're exposed, especially to those environmental factors again, for instance, skipping meals, taking the inappropriate diets, alcohol, smoking, being under a lot of stress, so there could be a recurrence. Now the upper abdominal pain starts and all of those other symptoms come on again. That doesn't mean it wasn't treated originally. It's just because you were exposed a second time. So my advice is, once you're treated and it's cleared, make sure you avoid as much as possible those environmental factors that have been identified. Welcome back. Thank you for staying with us. Let's continue our discussion on peptic ulcer. There are certain things you need to do to prevent yourself even from getting peptic ulcer in the first place. So to prevent peptic ulcer disease, I've decided to divide it into two broad categories. Again, dietary modulation and lifestyle modification. Dietary modification is the fact that you have to watch what you eat. Peppery food, spicy food, fried food. Sometimes again, drinks that have a lot of gas. It's important to listen to yourself and understand what either brings or worsens the ulcer. Whatever you've seen that causes it, you need to make sure that you stay away from it. Now, lifestyle modification is the fact that you need to reorder your lifestyle in such a way that it is more healthy. You need to live a more healthy lifestyle, which is part of it: avoid alcohol, avoid smoking. Anything that will put you under stress, it's important you stay away from it, because stress will also lead you to developing peptic ulcer disease. Now, once you've been able to do most of these things, I am sure that you won't have peptic ulcer. I hope you have learned something today. Thank you for staying with us today. But remember, until what you know becomes what you do, you don't know anything. Watch out for our next episode. But please do remember to leave us a comment and follow us on our Facebook and Twitter and Instagram channels. Send me your comments and messages. I'll personally respond to them. Until come your way again, I remain Dr. J.